Good afternoon, everyone. This is Daniel Stein, your intrepid host, along with Dave Walsh and others for today's call. I want to apologize a little bit for not getting out the meeting notification a bit earlier this week. Been a crazy busy week for us, as well as I know a lot of other people are traveling or at conferences, and we actually debated whether or not we were going to hold the call this week, but figured would be a good time to keep the cadence going, and I know there's always interesting stuff to talk about. So what we decided to do today is, hopefully this will advance for me. So the agenda for today is pretty simple in terms of what we wanted to cover. One is we'll do some welcome and intros. We always love to hear who's new to the call. And then what I wanted to do was I spent a little time talking about the Connected Healthcare Conference and the Interoperability Mural Gallery that we'll be holding there for a couple of reasons. It's a great opportunity for us to expose and get exposure to particularly the healthcare community. And also it's a way, I think, for the community to think about how we engage with other domains and other communities, and thought that would be of interest to you. And there are people who will be attending also, want to talk about that a bit, and people who may have interest in attending in Boston. And then Dave Walsh is going to take us through a preview of what I've, a little noise in the background here. If you're on, you can mute yourself, if you don't mind. I actually might have a little control problem here, so if people can just mute themselves if they're doing other stuff in the background. So Dave Walsh is going to talk a little bit about the open source Fire-based focused proof of concept that Dave has been working on for several years, various iterations of that over time, and kind of give us a little bit of a preview for our topic for next week, actually. So this is just an opportunity to kind of get familiar with it a little bit and to think about it, and Dave will help us with that. And then importantly, I wanted to, we're putting together a calendar of events for the next couple of months, and we have a number of options that we want to share with you, and we'd like to get your thoughts on it, on what's interesting to you, if there's a particular order, and what the cadence of these things might be, so that we can, in fact, measure or at least organize these events in a way that is most useful and helpful to the audience here.
Daniel, let me interrupt for a second. Event sounds a bit like, conferences and stuff. You mean the schedule for these calls?
Yeah, monthly.
Speakers and topics. Yeah,
absolutely. Thank you. Yeah, that's exactly what I was talking about there. Right. But I consider them an event. But you're right. It's absolutely that. So, let's just spend a minute now. I know there's a few new people online. What we've been doing is asking you to just on the chat function, just type your name in, and I can just call on you, and you can announce yourself. Give us a little bit of background to everybody, to the folks, or if you haven't been on in a while, just say hello, what you do, where you work, so we kind of know who's on the line here. So Ash, why don't you start off, since you're the first person.
Hey, hi, can you hear me?
Yes.
Okay, I'm Ash, I'm from Memphis. I'm student of Masters of Health Administration at University of Memphis.
Great. Well, welcome.
Yeah. Thank you so much.
Yeah. Marianne, welcome to the call.
Hi, I'm Marianne Cooney, and I'm from the Association of State and Territorial Health Officials.
Terrific, thanks. Who else is new here? Anyone else join the call?
And this is Ark Hill from the New York Foundling.
Oh, hello, Ark. Nice to see you online. And who else? Our ICE Cyber Security folks. You guys got to change your name.
Yeah, it's not the first time I've heard that. Don't worry.
Yeah.
Yeah, I'm John Scott, ICE Cybersecurity. or will probably be on the call later also. San Diego,
Great.
California.
Great, welcome. Hi, Barbara. Oh, have no mic today. Okay. Welcome. Thanks for joining again. Anyone else new to the call today that wants to introduce yourself? Put your name in the chat and we'll go with that. Okay. So welcome everyone. And as I said, there's kind of three parts to this. The first one is an introduction to this event, which is the Connected Health Conference. I'm just going to speak for a few minutes on this. And before I get started though, I wonder, is anybody signed up or anybody going to this event in Boston in the middle of October? Aside from our team there. All right, so this is a new event for people, which is great. It's the 11th annual Connected Health Conference. You can see what's on here. It's designing for healthy habits and better outcomes, and it's a HIMSS innovation account conference, which is terrific. And they invited us, and we actually asked, and they invited us to participate in this event. It's a pretty large event. It's approximately 2,000 professionals, lots of speakers, lots of exhibits from all over the country, all over the world, and it's all about connected health. And so we're excited because a lot of what we're trying to do, obviously, is to try to connect in with health and try to make the connections between health and social and education and public safety and all of those things as well. And so we feel like it's a really exciting and interesting opportunity, both because it's HIMSS and the influence of HIMSS on the world of health is obviously quite significant across the country and across the world, and also because of what appears to be a greater and growing interest in things that we've been talking about in terms of cross-domain efforts as well as social determinants of health. And so we feel like if we can participate in that conference and begin to socialize and make folks aware of the work that we're doing at Stewards of Change and at the National Interoperability Collaborative, we hope to invite more people into the collaborative, and we hope to forge and create more relationships with folks on the clinical health side and the clinical innovation health side of what's going on out in the field there. So it will give us a great opportunity to obviously connect with folks. And if folks are in and around Boston and they have interest in participating, do let us know. We have some opportunity and some registrations. What we're trying to do is, as you'll see in just a moment, we're creating a gallery, and in that gallery we'll be sharing with the people who come through it a bunch of material and content that we've been developing over the last decade or so. So on past calls, I've mentioned in the past the work that we've done around both creating symposia and conferences and training and learning seminars. And during those events, which we've held now for the last 13, 14 years, we have done a lot of graphic illustration. And you've, I'm sure, seen a lot of that more recently. And that graphic illustration, in addition to being sort of visually very interesting and exciting, it also contains a huge amount of information from the conversations and from the work that we've done, either in symposia or strategic planning effort or brainstorming or visioning. And so we've been able to bring those together a couple times now. We did the first one in San Diego back in the springtime with San Diego was our inaugural one. To really feature the work that we were doing. We got very excited about it. We had a terrific response to it. And then we were able to bring a smaller gallery to the MESC conference that Elena, who's on the call with us, runs. And that was a great opportunity to begin to expose the Medicaid world a bit more to this work and being able to share the efforts that we're doing. And so we are really wanting to in a sense, socialize or evangelize the work, the cross-domain work that we've been pursuing, and that is integral in many ways to the real focus and mission of the Stewards of Change work. Now, what I want to do is show a video for those of you who are online. You can see this video. If not, you should have gotten a link yesterday with the announcement on it, and it's also available on YouTube under the Stewards of Change. So it's just a 3-minute video. I believe this will work. We're going to give it a shot over Zoom, and let me give it a shot. And if it works, great. We'll talk about it on the other side of this thing. So. Adam, if you don't mind, when I turn this on, just giving me a chat message that you're all hearing it. Okay, here we go. Almost, here we go.
I've never seen anything like this, either for interoperability or for something else. The idea of having these live notes that are built as almost a body of knowledge growing is truly innovative and really pushes it forward.
Often we go to conferences and we hear all these big ideas, but very often they're very abstract. But this gallery is a great example of showing you individual stories of how to make that into concrete details.
It actually tells a story that makes sense. It's just amazing. I've never seen anything like it.
You go to conferences where there's poster sessions but there's other like visual representations of work. But these ones are unique. I think the way that they're done kind of draws you in as the viewer.
I am struck by the amount of work that's been done and the historical perspective of the work around public health and systems change and the data and all of it. I think this gallery is powerful in that way. I've never seen anything like it, honestly.
It really helps open your eyes, being here in this hall with all the visuals of the work that's been done over the last decade plus.
Just walking around each one of these beautiful murals is a snapshot in time of the human experience. Like, where are we with what's working and what's not?
I think it's phenomenal. I didn't realize there was this rich history. I think I'm on a couple of these things. I've taken part in a couple of these things, but I've learned a lot, and it's great, the presentation.
Really exciting for us to be here with all of our murals and all of our examples of work we've been doing for the last 10 years and the journey we've been on to drive interoperability and information sharing. We've designed it so it's portable because we want to be able to take it on the road and share it broadly across the U.S. and for communities who are trying to drive interoperability and information sharing. It's been really exciting over the last couple of days here to actually see people and hear people's experience with the murals. It's incredibly stimulating to folks, and it really conveys the history of the journey we've been on, and a lot of people at this conference have been on, to really drive interoperability and innovation over the last 10 years or so.
The concept of interoperability, I think, is lost on a lot of people. What this gallery does is create a visual representation that makes it digestible, easy to understand, and really hits home just how important it is.
And there you go. Moving right along here. So before we go any further here, I hope that that was interesting to see. Kind of gives you a sense of what the gallery is about. We've redesigned it so it's actually more enclosed, and it will be it'll be like a labyrinth in Boston when we show this out there. It'll be a little more contained in terms of what we'll be showing. I'm aware that sometimes the pictures and the sound don't always match up here. So I'm just interested if folks have any particular response or thoughts to the visuals and the gallery would be great to hear. And if you're traveling, if you put stuff on mute, that'd be great. There's a little bit of background noise, and somehow I have trouble being able to mute folks. Great. So in terms of what we're trying to accomplish here is through the murals is the idea that we've talked about in the past, which is how do we cross domains and how do we begin to share or continue to share and expand the sharing across the various domains. And that has been the topic of a number of our conversations so far as part of the Let's Get Technical. Trying to work both within a domain, such as social services or health information technology or health information, is clearly a challenge in itself, no less going out and across other domains. But the purpose here is to begin to show the collaboration across the various domains that we have. And I think that's the edge that we bring to the table, which is how do we do that? And how do we enhance that work to be able to share information both technically, legally, organizationally, and from a workforce perspective across these 6 domains, which in many ways are kind of a summarization of many programs that fit within those. And so that's really been the goal. And we hope that the murals and the mural galleries begin to show that. So the pictures and the imagery on those murals depict various aspects of the domains. And what we have done and we intend to do is to facilitate that conversation and to draw people into how they see themselves in this work and how they can see themselves reaching out to other domains and what they need to do in order to enhance those kinds of connections. And it's an ambitious goal, of course, but it is something that we think is really, really relevant and kind of a unique placement in the field here. For those of you who participated in some of the galleries, I know folks, a couple of folks on the phone here. I'm interested in your thoughts if you're willing to share kind of what your perspective has been as you look at this work and how we can use that more effectively to share with others both inside and outside of our field. Any takers?
This is Marcelly. I think it's a beautiful and an effective way for people to make sense of why it matters. So I think you've done a really substantial, a very valuable job at documenting the conversation, what the aspiration is, and then my encouragement is that we can use the murals and navigate away from the word share, because share, people assume the word share means to copy, to give all or to copy. And as we move to how do we access, use, or control information cross-domain, cross-border, I think that in itself, combined with the art, so people recognize why it's worth it, help to resolve what can we do within the current policy situation, and then within that frame, what can we do with the technical components of the data structures so that the information that's made available or accessed is meaningful.
Well, I definitely agree with Marcelly, and coming at this from a little bit more of a technical perspective, it's certainly easy to get lost in the details, and I think the murals are a great way of enforcing why we are doing this. What are the issues that we're really trying to address? So I think it takes us up a notch, figuring out what are the needs and what are the approaches.
One of our goals is also to be able to bring this, these discussions that we're having, but also the body of work into other domains. So for instance, this is really, we brought it to the Medicaid conference and had some great exposure. In fact, one of the folks there who, one of the groups that was at the conference was from the prescription drug and the pharmacy world, who Adam and I had a great conversation with. And you'll see in a couple of slides, they had a huge amount of interest. I was somewhat surprised about their particular view of interoperability and how the pharmacy world and the whole prescription drug world is struggling with many of the same kinds of interoperability challenges that we look at within our universe. So one of the things it's done is really it's beginning to excite and stimulate ideas from and ideas within other domains that we want to reach out to. And so one of the ideas is to be able to take this, as I said, into the health field, but also potentially into the public health conference domains, also as education, public safety, and to be able to show up in those conference settings and to be able to engage in those conversations. And I think one of the goals of the work here at the NIC is to create that community in a sense that is both versed in and able to speak about the cross-domain efforts. And so we hope to be able to engage folks on the call and part of this group and part of the team to be able to participate in those conferences, be able to, in a sense, cross the border, cross the boundary, to be able to share with folks as we go forward over the next year or so. So as you hear about conferences, you think about places that we ought to be going. We're certainly interested in your thoughts and recommendations here.
So Daniel, one of the things I was wondering, it's Mary Sarah, on the previous slide where you were showing the domains.
Yeah.
Why is mental health not listed? I just want to understand the thinking where. And the reason I ask is it poses such complexity, I think, or perceived or actual for a lot of entities, and it seems to be underlying a lot of the use cases that agencies are focused on right now, whether it be addiction or homelessness or child safety.
That's a great point, Mary Sarah, and I think that we've kind of struggled with this particular the naming of this domain. So originally, when we were doing this work, this report, which you see on the right side for HIMSS, there was a lot of interest in health information technology, obviously from HIMSS's perspective, and we kind of maintained that. But that question has come up several times, and I think one of the things that we can do probably is kind of redefine or rename this particular domain. So it's not health information technology so much, but it's really health writ large. And I know that doesn't necessarily address your issue around mental health and behavioral health, which in the past we've heard specifically that it's they, as well as a few other domains, sort of don't see themselves or see themselves as separate from a health domain. And I don't know if renaming it health would be useful for that regard. I think when you read the material, I think we have a broader view of it. But that's a question that kind of goes back and forth: is how do we sort of identify the right number of domains without having like 20 of them, right? Because we don't call out transportation, we don't necessarily call out labor, we don't call out, as you said, behavioral health, and there are others like that we're not calling out. So one of the challenges is how do you summarize domains and yet not lose the specificity of them. So I don't know if you have a perspective on that.
I think it would be very interesting to list out the domains by the legal framework of a domain. So substance use, mental health have their very, very separate requirements around what is allowed to be made available or used. So not necessarily conceptually the cross-domain in the human experience, but it's very helpful and useful for people who are trying to make their technology work and make sure they've done everything they need to be able to check a box, to be able to exchange or make available data. So on that piece, it would be very helpful for NIC to have some sort of a visual of the domains, because transportation has one, a lot of mental health is their own, and substance use and pediatric, and anyway, it'd be very, very helpful, I think.
Are there Are there folks on the phone here now are saying, oh yeah, my domain's not represented either. We ought to really be looking at X, Y, or Z. You don't see yourselves as part of one of these necessarily. Or can you see what you're doing and, you know, sort of subsumed into whether or not it's social or health or public health? I'm just trying to get a sense of whether or not there's other senses around that.
Yeah, and I think Daniel, we can make a distinction. Like transportation is really a service, as opposed to a domain. We're not looking to have good transportation for the sake of having good transportation, but we are looking for good mental health, for good education, for good public safety, right? So those are all domains, but then there's a number of services that are going to be necessary to support the health of those domains and the individuals within those domains. So I think we should keep those separated, but I think if you would just, the renaming might be helpful, but I do like the comment that was made about the specific legislation for mental health and substance abuse or substance use disorders, because I think it's important that people know that that's addressed before they get to the detail.
Right. Thank you. Thank you for calling that out. I think that's an important topic. That is, it's not the first time it's come up. So I think we'll sort of revisit that and see how we can sort of reposition that, or at least define these things better to show what is included and what's not included in them. That will be helpful. Great. Other comments from folks? So one of the things, just a few more slides on this, and we're gonna move along here. One of the things that we want to convey, as I said, is this whole gestalt of being able to think across domains and across sectors. And one way we do that is we talk about this in terms of interoperability. So it's what you do with interoperability after you've connected the boxes and wires, and you've got the data, or you've got access to data, if you're not sharing it or if you're making it available. How do you take advantage of that, and how do you leverage that? And so that concept of, you know, being able to connect systems and optimize them by being able to use the data is kind of the meta framework that we use to think about all of this different work that's coming together, all these streams of work that are sort of driving towards each other to be able to share information. And we talk about it as sort of integrating and operating and optimizing the work. Again, to provide a slightly different frame for how to think about this kind of work that's new and unique and different. Because many jurisdictions are working on connecting systems, ideally making use of that information in some functional and useful way. But as a way to think about it, and as a way for the field to think about it, it feels like there needs to be a different framing around what we do when we bring all this together and what the ultimate goal of it is. And obviously some of it is integration and some of it is optimization of both services and resources that we have available. And so we talk more about that. And again, we're trying to sort of build out this conceptual framework within new areas and within new domains or folks that we're trying to bring into the conversation here. I think one of the things we'll do, and we'll come back to if we have some time, is the whole area of social determinants, of course, is something that has grown tremendously in terms of level of interest and awareness. And over the years, we've had a number of specific sessions on social determinants. This one particular mural articulates many of the particular issues that are addressed here and that we're addressing. And I'm showing you this because this is, again, this is an 8-foot mural. It's attractive to look at, but it takes a while to kind of read into it and see what the key topics and core ideas are of what it is actually that's happening. Again, it's a topic that I think infuses much of the work we're doing. We have a separate social determinant group that has lots of people who have identified their interests in this area. And it'll be a topic that I think we'll want to come back to multiple times going into the future as we dig into aspects of the social determinants or specific components of it and specific functional ways of actually integrating that into the care and services we provide. I'm just providing this as a kind of just as a placeholder as we get into the conversation about what other kind of topics are going to be useful and interesting for us to address. So before we move on to the proof of concept, I'm going to ask Dave to take over here. I just want to open up the floor for people's thoughts about any of the stuff I've said here, or how you view this sort of integration and interoperability work in your own domain and some of the challenges and opportunities that you see happening, if stuff comes to mind for folks. It's a quiet crowd today. Okay, so I guess what we'll do is we'll transition over, and Dave, if you would like to talk some about the proof of concept and the structure of it and where it's come from and where you're thinking about, and we'll go into more depth on that, of course, next week when we have the full presentation. Dave, I think you're still on mute.
You're absolutely right. So does the deck that you're sharing, Daniel, have those slides that yeah, great.
Yeah, it sure
so
does.
If you can just go back to the beginning there. Let me just reintroduce myself, Dave Walsh. I've worked with Daniel and Adam and Stewards of Change for about 5 or 6 years now. And what we've really been doing, because my focus was healthcare and specifically Medicaid, is start to communicate about the value of looking at the individual holistically, what their other life circumstances are and so forth. Is that me doing that, Daniel? No. So one of the things that I've been real involved with for the last 15 years or so is a group called the MITA TAC, or MITA Technical Architecture Committee. And we have focused primarily on technology in healthcare. And the way we did that was to build proof of concept implementations. And I think the gallery is a good example of something that we were missing. And we started to address that 2 years ago when we took as the basis for our proof of concept a use case, a user story. And that particular one was about opioid addiction and an individual that got caught up in the system and needed to be able to have a care team collaborate on their circumstances, and that individual be able to grant consent to share on their information. So it shifted from pure technology to the message that's given out by the banners that Daniel was just showing us, and saying there's a user story behind this. There's a reason that we're trying to make this data interoperable, and that all has to do with an individual and keeping their information secure and private and so forth. So for the last 2 years, we have been working on a use case and then fleshing in the technology that is needed to support that. And in healthcare, there's a lot of momentum right now in information sharing, specifically targeted at the fast healthcare interoperability resources. There's new rules that are going to be coming out by CMS in the near future talking about how that needs to be implemented going forward. So there is a foundation of technologies that the healthcare industry is focused in. And what I would like to do is see if there is interest in this group. So I'd love for this discussion to turn much more interactive, but an interest in this group in leveraging what's coming out of healthcare, because there's going to be significant investments there, and using them in the human services realms, and really looking at how we build a framework to support the people with the services that they need. So the value in a proof of concept, in my opinion, is it is educational to the people who are actually working to implement that. You learn whether you're actually implementing a piece of it or listening to what somebody else has done to implement it. So it's got a lot of value in the educational perspective. The other piece is reuse. Once you identify component pieces, I'll give you an example, and that is consent to share. Then the reuse of that, which started back at SAMHSA, putting together a consent to share module for us to be able to look at that and quite likely reuse it. That particular one is open source, so it's free to be reused or to derive products from that. And in next week, we hope to have an individual by the name of Brian Book, who took the SAMHSA project, which was called OCP, and it was a care plan based on fire. And this individual, Brian Book, and his company are moving that forward into a open source initiative for care plan management and the definition of APIs using fire to be able to extend what is being offered in that framework. So what we have done so far is really proving the ability to reuse these things, especially when organizations like SAMHSA make that available as open source. It also provides us capabilities for a number of things, such as testing, specifically testing for interoperability and partnerships. So an example of the partnerships could be that a individual on this call gets familiar with some of the open source work that Brian Book is doing in a product called Care Nexus, which was the open source product that I talked about, that they can actually form partnerships for specific aspects. So if you need a consent to share module, but that's not your primary focus, that would be an ability to form a partnership. These people do consent to share and somebody else is doing the mainstream. So partnerships wind up being really important moving forward. Next slide, Daniel. Are you there, Daniel? Okay, so what I would like to do is kind of open this up a little bit. Let me just walk through what one of some of the initiatives that I could foresee being beneficial to use cloud services, and that's where the world is certainly heading right now. But then to define a framework that allows us to exchange information. And initially, that effort would be focused around fire, because again, fire will be getting a lot of traction and funding over the next year. And it is basically solving the problem of exchanging data in a secure manner and defining as a community what that data looks like. What are the data models? So the FIRE initiative coming out of healthcare and its associated technologies like SMART, which allow you to perform the authentication and the authorization, securing the data, is all a part of it. But then for us to fold in, if you will, NIM and the NIM data models and eventually develop APIs. So we have talked in the past about NIM and how NIM data models might be able to be transported over the same transport mechanisms that FIRE is, and developing APIs to be able to define concretely how you're going to be exchanging that data. So just one more slide, Daniel.
Coming your way.
Okay, so this is a very poorly done artwork, but it does describe fundamentally what we're talking about here, where different domains can have what they call endpoints or services that they can offer to be able to accept data, to be able to distribute data, and so forth. And the various capabilities there, like authentication and authorization, is this individual able to access this data for this other individual? That's all part of the FIRE and Smart on FIRE framework. So what I would like to discuss is, does it make sense for us, now that we've discussed a number of these things, to start on an effort to build a basic proof of concept for sharing data, where the more technical people on the call can actually roll up their sleeves and help implement some of these services that are going to be shared, some of the various domains, and build something where we can all learn. So if you're an implementer, you're learning by implementing it. If you're somebody who is not an implementer, then you can follow along as we do it. In the end, producing a proof of concept demonstration that data can in fact be shared by a citizen, by a patient, by a provider, by a care coordinator, and they can have access to all of these services if their authentication and authorization allows them access to it. So the question, I guess, to the group is, what does the group think about starting with a very basic framework that is born out of what's coming through in healthcare, specifically FIRE and so forth, to actually build something where we can do a deeper dive on the technologies that are required. So I'll be quiet for a minute, and I'd love to hear people's suggestions, thoughts on really building a proof of concept to show how this is accomplished.
This is Brian Hanspicker. I absolutely love this idea. Can't wait to get started on it. And by the way, if you would like, Dave, I'm more than happy to take your diagram here and make it prettier.
That would be great, Brian. That would be much appreciated.
All right, I'll work on it over the weekend.
Okay.
Hi, Noah Marks. I have a couple of comments about this as I'm looking at it. First, you know, it's worth saying that with all of the hype around FIRE in healthcare, we need to remember that actual implementation, let alone implementation in production, is still quite limited. And to some degree, healthcare really hasn't yet come to terms with or even demonstrated well access to data, even just within the domain, but across organizations using FHIR. That's sort of one thing. So yes, it will likely quickly accelerate, but you know the inertia of the installed base of standards and technologies is quite strong.
How would you feel about the idea of doing in parallel in HL7B 2.5.1 adaptive?
HL7 version 2 is a very different beast. Look, it all depends on the data. So, but let me continue. Keep in mind also that SMART as a technology is about the presentation of FHIR-based resources in a user interface. If the type of data access you're trying to do is, as many of us do, is a bit more back office, you know, a bit more, transparent to the user, is sort of back end between systems, as we often do move data around, right? SMART is not a relevant technology for that. SMART is about presenting to the user. Third, because SMART is really tied to FHIR, I don't understand on the three right-hand domain towers, education, housing, justice, in the fourth box down of the skinny boxes, how SMART is relevant there. It's only relevant if FHIR is behind it. It's not relevant if NIM is behind it. It's orthogonal, right? So I'm puzzled by that presence there.
No, this is Brian. Remember that NIM is just a data model. It is not a transport protocol. So one of the things that Dave has suggested, and I think is a brilliant idea, whether or not it'll pan out, I don't know, but that's what these proof of concepts can help us understand is, can we turn around and use FHIR as the transport protocol to exchange NIM messages? And
no, I don't see FHIR as a transport protocol either. FHIR is also a data specification. It is the resource definition. That is the most important thing about FHIR. It happens to incorporate REST as well, but doesn't have to. But I don't conceptualize FHIR as a transport. I conceptualize it as a data model. So I'm a little puzzled by that.
No, of course it is both. Of course it is both. We're simply talking about making use of the same RESTful-based APIs and the associated underlying HTTP as protocol for exchanging NIM messages as well as FHIR resources.
Right, but SMART is a function of FHIR resources, not any resources.
So just a couple of quick things, Noam. To your point, and I was expecting you to bring this up on my horrid little graphic here, but you'll notice we're in here, we're talking about FHIR transports, which happen to be REST. And as we get over into more human services, we do just say REST as a protocol. One of the goals here is, and it was that top bullet, was education. So to get the whole group understanding, here's what's actually happening here, whether you're coding it or whether you're just following people who are coding it, to really get down into the details that you're getting down to, like REST is the transport mechanism to get the information from point A to point B. And, you know, this too, I think could be a good mechanism for us to resolve some of those issues. The example being SMART. When I think SMART, I think a part of that is OAuth 2 for the authentication, authorization pieces and so forth. So maybe SMART isn't the right name, but SMART really does contain OAuth 2, which happens to be the predominant way in which authentication authorization is handled, certainly from mobile apps or from a server to server mechanism. So, you know, I see things a little differently than you do in terms of is SMART relevant, because my mind thinks, well, SMART is really OAuth 2 and some other goodies in there, and that's what's used for the authentication and the authorization. So we may change SMART down here to OAuth 2 plus whatever else we need to have in there. But actually engaging on something, starting with the simple and resolving any misunderstandings about those, I think is part of educating the group on, oh, here are the things that we need to be concerned about.
I agree. That's the reason for doing the proof of concept.
Yeah,
I understand. Look, and I'll just say this, and then I'll shut up. You're right that SMART uses OAuth 2, but OAuth 2 doesn't have to be used only by SMART. In other words,
absolutely.
The two are independent. So it's in some ways I think misleading to couple those two tightly together. If it's about OAuth 2, I think you should say OAuth 2. You don't have to bring all the SMART baggage if all you're really trying to do is include OAuth 2 in your conception.
Right. Right. No, and I really appreciate your insights, but that's part of the goal here. So when Brian refines this beautiful graphic I've got here, he may want to put in there OAuth 2.
I'm taking notes.
OpenID and so forth. In the healthcare world, you know, if you are looking at, I can use an example of the Blue Button 2.0 project, where CMS has put some synthetic, some real Medicare information up there. But to get to that, you need to go through the authentication, the authorization. And what they have done is used SMART to go do that. And it's going to be important, you know, if we in the human services arena say, let's pick on education for a moment. If we're going to have multiple clients, citizens, patients, students, you know, a number of people, teachers, being able to get to the information in that domain, then we probably need to have a standardized authentication and authorization mechanism. So we may not call it SMART, but it will be these different authentication authorization mechanisms to be able to get to that data. And it needs to be the same so that each of these people who are trying to access that information are following the same rules to get to that data.
Dave, this is Daniel.
Hey, Daniel.
Thanks for the preview of a deeper conversation that we're going to have next week. I think what you're raising here, a lot of technical questions, and I know that there are probably a few people on a call who are sort of
their eyes are rolling back.
Maybe a little eyes rolling back. So
certainly glazing over.
I'm not sure about that, but one of the things I think about because this is really an attempt to, really dive in pretty deeply into this conversation. So as we get ready for next week, one of the things I think we want to make sure we do in terms of communicating out to folks who are not on the call today and who are on the call today, sort of the nature of the conversation. And I think we ought to make sure that, we're also defining terms a little bit. So as you and maybe Brian get together and Noam and others, if they want, in preparation for this conversation, that we kind of lay out the ground rules and explain that in the communication that goes out early next week, so people can really prepare for it. And clearly, there's a lot of technical conversation that'll go on here that I think will be very attractive to a number of people who are there, and many of the rest of us can learn from that conversation. And especially the work that you've done to bring people together from across multiple different organizations and companies to develop this kind of proof of concept. So I want to thank you for that. And just as we prepare for next week, just keep that in mind. And we can, just as we lay that out, that'll be helpful as we describe to people what it is we're trying to accomplish here and how to get there.
That sounds good. So does anybody have, I'm a believer that even if you're not going to get technically mired into all of the detail, to understand that to create interoperability involves all of these pieces, whether it be OAuth 2 or SMART, whatever we call it, to have a basic understanding of how these things work, I think is important as we move forward. I would love to, over time, have templates, if you will, of how you could make a domain available across here. And I think this audience could all understand that these are the things that need to happen. They may not need to understand all of the minutia about it, but the fact that they need to happen, that they need to be considered, I think is important. So I'd love to hear people's comments on that.
Hi, Dave. This is Rita. How are you?
Hi, Rita. How are you?
I'm good. I know this is a depiction of I think what you envision of the future, but like at least for the healthcare domain, and I know you this is just like one basic visual, but like I don't think there are other standards that are necessarily going to go away, like some of the other HL7 standards that are not based on FHIR, or even IHE standards. And so I don't know if those still need to be part of the future in terms of like how the current state works, or like what's like, how things work, currently. But I don't know. I mean, I'm not saying that this isn't, like possible, but just to consider that it might be like just it's still a little like too high level. I'm sure there are other details that'll need to be fleshed out.
Oh yeah. Yeah, when I look at it, Rita, I think that the group that is on here is fundamentally leadership kinds of people, and what we're trying to do is, in my opinion, help educate the group so that they can lead effectively. So if there's going to be significant investment in the healthcare arena that we could leverage with our activities, that would be something that I think could benefit us all.
Great. So I think that maybe one of the things, Dave, we can talk about, and I don't know if other people feel that way, is maybe just defining some of those terms quickly at the beginning of next week's session, and making sure we've got a little glossary for folks there as we go into this, and see if we can get into that deeper conversation.
So this is Daniel. I just wanted to make one comment. Let's try not to forget public health when we're thinking about the domains that are essential in this particular proof of concept I think that, you know, based on the conversations that I've had, and many of you on this call have had, is that public health has to be part of this, this build, whatever it is we're going to be building in the future. And the resources within public health departments today are so scant that any available opportunity that we have to become a partner in these efforts, particularly if it's building infrastructure, is essential.
Yeah, so we'll get into it more over time, but one of the opportunities that I think we have is to deploy a cloud service can be fairly cost effective if you have a template. So what I'm thinking here is that as we go across more domains or variants on a domain, is that you could have templates of how you implement the functionality that could easily be implemented in a cloud-based service and make it much more cost-effective than building a custom system. That's my thought.
Hey, Daniel, this is Henry.
Yes, hey, Henry.
Hey, Henry.
Hi, I'm glad I could stop by and join. One of the things that I observed is, you know, working in many, many messy implementations in the past and having to understand the trade-offs and you know, try to answer the question, you know, is this an opportunity to create interoperability? I think often the challenge is that, you know, programs, policies, and even funding are actual impediments to interoperability, because when you're trying to establish programs and policies, you know, it doesn't envision that, you know, you are going to interconnect with the world. It just focuses on that particular set of policies and program implementation. So, you know, some of what drives the difficulty that we have is, you know, are those things that had not envisioned, you know, from the business and policy side of all this, you know, kind of interconnectedness, although you do see it afterwards, right? So, you know, we live the results of that lack of, you know, kind of forethought. So I think it's important as we try to, you know, kind of experiment in developing a concept or, you know, a prototype, is to look at what we could stay away from that are behind the firewalls and all that messy technical debt that's created by, you know, fragmented policies, and try to decouple the back office operations, as you know, someone said earlier, that is really, really unique to a lot of organizations. And then try to look at what is common. For example, in a social determinants of health situation, you know, if you have community-based organizations, you know, healthcare professionals, transportation providers, substance use disorder, treatment, you know, counselors and care managers, all trying to understand basic elements of who is this person and what am I dealing with. Maybe we can build something that is needed by the, you know, the community of care providers, but not necessarily go so deep into their individual business processes. So Dave, this is not unlike, you know, the previous attempt at trying to look at provider directory, for example, in healthcare, and trying to build, you know, some kind of prototype around that. So I'm just making a comment that if we're going to do something, it should be relevant and not just purely experimental.
Absolutely agree. So I don't know, Henry, if you're on a screen or if you're just on a phone right now.
I'm just on the phone right now.
Okay. So I'll send you this little diagram, or Daniel can send it to you, but I'd really like your opinion on it, how far off we are from what you believe the future to be.
Just a note, this will be posted on the site as well, so everyone will have access to it. We can send it to you, Henry, as well. But I think these are good questions. I'm really excited actually about the possibility of the kind of conversation that we can structure next week. And I think it'll be important to really highlight the nature of the conversation so we can make sure people who we want to have in the conversation make time to join the call and really start this up. And this certainly could turn into a separate project team. I'm sure we're not going to get through everything next week on this. Just even your introduction today, covers a lot of ground. But if we have the kind of conversation and sort of start that momentum, I think creating something to what Henry's talking about and Marianne in particular about what's pragmatic, what's useful, what makes sure we're inclusive of the domains that are both represented in the group, but more broadly, that will be very useful and valuable. And I would encourage people to bring to the call other folks, if you have other technical folks or policy folks that you think could really participate in this call and contribute to it. That would be a really good time to make sure that they're on this one. I know not everyone can make every call, but that might be a really good one to get started on.
So is there anybody on this call that thinks building a proof of concept similar to what's lined, and it'll be much prettier next week. Thank you, Brian. Is there anybody who thinks that just doesn't make any sense?
Well, this is Noam. I think we need to look at these standards a bit more closely. So I think conceptually, sure, it makes perfect sense. I'm not sure, for instance, that SMART as the overriding sort of architecture for a multi-domain sort of query and presentation to a user is actually right.
Gotcha. Okay, so we'll refine this a little bit next week. Daniel, can you go to the next slide?
Yeah, I think we're going to go into.
Okay.
We have 2 slides left. We have about 15 minutes or so left. And what we want to do 2 things. And one of those things is just to give you an idea of some of the meeting topics that we've been doing some outreach on, and then talk about kind of what the right cadence is of these meetings in terms of presentation, discussion, and how we vacillate between those 2 things. So let me just before we get into that, because what we want, one of the things we want to do is to provide a schedule over the next couple of 2-3 months in advance, so that we actually have a schedule. Because it's both from an organizer perspective, it's hard to go week to week, and we want to make sure that there's good preparation. And I know, as I said, I know everybody can't make every meeting, but if there's ones in particular that a couple weeks out, if you want to join, that you have that schedule ahead of you. And so these are just some of them, and I can kind of run through these very quickly. And then I'd love to hear from folks if there's something missing, if you had to vote for 1 or 2, or if you had to vote for a couple, which ones do you want to hear about most? And if there's ones that are missing from here, we'd love to hear your thoughts about that, and we can go out and try to source some presentations on that.
Hey, let me jump in for just 30 seconds to say that we do want to build this schedule, and I think we would all agree it's important to do it. But we want to be flexible too. So if a topic organically comes up during a meeting, we're not going to put this into stone so that we can have something live and that's of interest or importance to the group. And if you don't come up with that, so that's point 1. And 2, if you don't come up with something now, but do in 3 weeks or something pops into your brain, this is going to be ongoing and flexible. So please reach out whenever you think of a topic.
Great. So you can read. I'm sure if you're on the screen, a couple of folks on the phone call. So I'm just going to read these out, and again, you can get the slides off of the Let's Get Technical group here. But the first one, we want to cover a couple more of the domains. A couple of weeks ago, we talked about education. We've talked about health a little bit. Some about social determinants. There's a couple other domains we want to focus on. So One of them in particular is public safety, is one of our sort of key domains. And Paul Wormley, who's on our board, has participated in these calls in the past, has offered to do that, potentially with another partner. We really do want to come back and focus a little bit more on public health and the key to, the key factors, the key things you're thinking about, or the key things that are really driving the public health field right now, and what we need to be taking need to be thinking about. Marianne, you've mentioned a number of things in terms of the state of the public health state, so to speak. Karen Smith, former director of public health, has volunteered to sort of participate on that. And Marianne, and Noam, you guys may want to also think about participating in that one as well. I'm just going to run through these quickly, and then we can open it up for a few minutes of conversation. The major legislation in terms of the child welfare field is the Family First Prevention Services Act. I know a lot of people on this call, a lot of people on previous calls are fairly involved with foster care and child welfare. And so we felt like, given the importance of that and the impact on state and local systems, we would focus on that. And we've talked to APHSA and Ann Flagg to do that. Dave Ross, who runs the Global Task Force for the Gates Foundation and is part of the Public Health Informatics Institute, who I've known from some of the Robert Wood Johnson, offered to do a kind of share what's going on outside of the boundaries of this country in terms of interoperability, especially in the developing world, and some of the innovative, cool things happening there. We had a presentation on TEFCA, and certainly there's a lot more to do on that. There was some discussion last week about understanding that from the Sequoia Project's perspective, as they look at trying to stitch this together and create more standards and approaches. Haven't spoken to Marianne directly yet, but I know that she'd be interested in it. I'm hoping she would be. The Gravity Project, and Dave spoken with Evelyn on that. You're probably familiar with Gravity to a certain degree, but it's looking at coding for the social determinants in particular, and trying to get some standardized approaches there. Just a couple more of these. California, the Department of Public Health, I believe, has created a series of use cases, particularly addressing 42 CFR, and they've made those very public and have offered to present those to us. And it really looks at behavioral health in particular, and how do you address some of the various use cases. I found that really exciting and interesting. Emergency medical response, again, another domain. And Sandy Dirth, who was she's the former director of the former International Society for Disease Surveillance, who did a lot of work in that area, expressed a lot of interest in that just as a person. Another area is early care and education, which fits into our education domain. And a topic that Greg brought up the other week and others have brought up, which is about, we all believe that sharing data and information is great and very, but there is an issue of abusability. There's an issue, of course, with the current administration, how much information we want to have out there. Another topic is on the whole pharmacy interoperability, prescription drugs. And Adam and I had a terrific call yesterday with Leanne Stember from the National Council for Prescription Drug Programs, who came to, we got to know a little bit at the MESC conference. And the issues, which again, were not particularly relevant or salient in my mind, was they're addressing so many of the same issues, not only around PDMPs, but many other issues around interactions. And then there may be other things that are involved with sort of APIs and fire resources and other kind of technical things that we might want to do some primers on. So I know the group is shrinking a little bit, but I wanted to open up the conversation, see if any of these are of particular interest or not so much interest for that matter, and anybody sort of gravitates to them. So let me just open the floor and get folks' perspective on things that are really most exciting to them.
Hey, this is Marianne again. So yes, I would be interested in many of these for lots of different reasons. I think when, I could see any one of these particular items that you have be of interest to the shows about the work that they're doing or the work that they're hoping to do, yeah. In particular with surveillance and then building that interoperability with the community-based organizations, the healthcare, human services, and social services, if you will.
Great. That would be great. One of the, that would be wonderful. And being able to, sort of promote some of these specific ones or generally to other associations or networks would be terrific. So, your thoughts on that, more of your thoughts on that, of course, will be welcome, especially on the public health part of things. Other thoughts? Areas of interest for folks that say, yeah, I really want to hear about that. Or no, I'm really not interested in one particular project or part of it. Well, I will take your quiet as a endorsement for the choices that we will make by putting these out. I know it's a little overwhelming as a list, and I see a couple of comments incoming saying these are all good topics. So that's great. We thought about this a lot. We've sort of distilled down, from the conversations we've been having. And I guess what we'll do is we'll sort of organize these in a bit. If there's I'm not sure there's a logical order to these. Some of it will be, of course, driven by people's schedules and availability. But we'll publish this and again, maybe ask for some more feedback, or if there's topics that we don't have that we do want to put on here going forward, that would be great.
Daniel, this is Marianne again. I do want, when looking at this list, and in particular, I think the opportunities in many of these particular topical areas or discussion topics, the opportunity to include issues around equity, and in particular, the potential inequity across systems and across jurisdictions that are available. We frequently look at the urban environment as the area that has lots of resources, at least as it relates to the ability to share data. There's many more partners. There's probably more business opportunities and resources. But let's not forget rural communities and how rural communities really can benefit from extending partnerships into rural communities.
Marianne, is there somebody who's got, in addition to yourself, in terms of that rural perspective, is there a group, is there an association, are there folks that we should be reaching out to? Because I know that has come up multiple times, and I think many of us are sort of very urban focused.
Yeah, let me give it some thought, and I can get back to you and Adam on that.
Great. That sounds great. And I think that the equity one is absolutely critically important. And I'm embarrassed to say we didn't include that here. Although we have had multiple discussions around that and have reached out to a couple of folks. So we'll make sure to add that in, because I think it's certainly crucially important in many ways. So in the few minutes we have left, I know we had some thoughts about whether the structure of the meetings and the cadence of the meetings is good the way it is, or whether or not we should be thinking about sort of mixing it up a little bit with a discussion of one of the topics we had on the prior page, or a broader framework discussion. Dave, you had some more thoughts on that, right? Would you,
Well, yeah, I did. A lot of that, Daniel, was focused on people's willingness to start to go down the path of defining a framework for interoperability. And with that in mind, my thoughts were to possibly alternate weeks where we're talking about services or capabilities that are cross-domain. So how do you handle authentication, authorization, data sharing, where are the data models, and so forth? And then the alternative week to talk about a specific domain and the specific needs and or data elements associated with that domain. So the thought was, and maybe this isn't the cadence, but to break it up a bit so that it was talking about issues that are relevant across domains and that could be shared versus domain specific. Any thoughts or comments on that?
Well, I think, you know, issues like race equity, which are clearly across all domains, are not just a good idea, but critical. We can't, this is a technical group, but if we don't have an overlay of, or a floor under us of what we believe and what we think the goals are in a meta sense, then then all we're doing is, you know, moving widgets. So I like the idea a lot of bouncing back and forth so that we are looking at these big pictures as well as the specific topics.
I agree with Brian.
That was Adam, but that's okay.
Oh, Adam, I'm sorry.
No, that's all right. I can be known.
Oh, I don't think you can be known. There's only one no. There's only one no in the world.
So whether it's a ping pong of cross-domain issues and then focusing in on a specific domain, or 2 weeks in the specific domains, once a month on the framework, but something that we establish a pattern where we're free to look across those domains and do a deeper dive on any specific one. And then ultimately, I would hope that we could define a lot of reuse between domains to be much more cost effective and much more capable of deploying systems using it. So whatever the pattern is, but it seemed to make sense to have a pattern of cross-domain, specific domain.
Yeah, I think putting it that way, Dave, is really a good way to think explicitly in how we design those conversations that are crossing domains. And I think that require preparation from people who are in those specific domains. So we would need to kind of create some questions and topics. So if we have one that is really addressing, you know, we want to address public health and education and healthcare, we ought to prepare that in advance so that those domains are represented. And and in many ways, I've said this, but I feel compelled to say it again. Part of sort of my strong interest on this is that cross-domain work, right? So we go deep into domains, and I think that's useful. I think we've been doing that to a certain degree. But to make that explicit, I think is really important. What you're saying is this conversation is going to be about going across domains, and these are the main domains. Here are the speakers, or here are the participants in the conversation. Here are the questions we want to address around a particular topic or issue. So you could even take the child welfare issue, which is cross-domain, but going deep into it 1 week and then kind of looking at how it would affect other domains the next week. I think that's a good framing for it, and helpful for people as they think about what the nature of the conversation would be.
I think that the presenters on each, when there's real specificity of a topic, it could be it's usually going to be domains, but it doesn't necessarily have to be. But when there's real specificity of a topic, I think the presenters and all of us need to be very thoughtful about framing it and presenting in a way that makes the cross-domain nature of it or use of it very clear. If it's too narrow, and then people might wonder why it fits into their world, the presentation should make it clear that it fits into their world.
Right. That's great. I think we have some work to do to explicitly state that, or to share that, and to sort of frame the conversation around those kinds of things. So great. Well, thanks for your input. We'll be meeting again next week, Dave and company, who want to participate in this POC discussion. we'll get together quickly and get something out to everybody and sort of shake the trees to make sure that all of our the folks who are not on the call today are aware of that and articulate that well. And other than that, unless people have some final comments, we can adjourn for the day.